Hi, I'm Nicholas May, and I will be your instructor for this course, CDS 525, Case Management in SLP. And this course could be titled Medical Speech-Language Pathology or Clinical Methods in Speech-Language Pathology, but it has this kind of nebulous title of Case Management. Just going through the syllabus here, you can contact me via email, my Gmail account here, nicholas.a.may@gmail.com, or via Blackboard. Currently, I don't have access to Blackboard. I'm in the process of getting ITS to set up my account. So hopefully that will be resolved within just a few days here. This is the Memorial Day weekend. So there are, I guess, not as many ITS folks available. So hopefully we can get that resolved soon. So this is going to be an asynchronous course. So we will not meet at any given time. And you can schedule a Zoom meeting with me by appointment or via email if you so choose. We can kind of work it out based on our schedules. The textbook for this course is the Johnson and Jacobson 2017 Medical Speech Language Pathology textbook. The third edition is what we'll be using. So this course is designed to be an extension of your experience in your speech language pathology clinical practicum work sites. So we will be talking about a number of medical topics that you may be dealing with in your clinical experiences. And we can kind of dig into a few of these here. So this is a good opportunity. We'll talk a little bit about the evaluation. We'll talk about diagnostics, and a number of medical speech language pathology topics. So as I mentioned, this is an asynchronous course, so we won't meet at any particular time. But let's see. Yeah, so we have a number of communication strategies here. Like I mentioned, email, Blackboard are going to be the primary methods. So once you and I both have access to Blackboard, it would be good for you to renew your notification settings or to make sure that you have alerts set to the on position for all relevant messages. There's a number of course objectives that comply with ASHA standards. You can review those, and some standards relative to the School of Education student learning outcomes for Alabama A&M. So you can review those as well if you so desire. As I mentioned, the textbook will be the Johnson and Jacobson. Some tips to succeeding in this course are pretty much straightforward stuff, but you can look at those as well. My teaching philosophy, course requirements here. So there will be readings assigned from the Johnson and Jacobson book there. Journal assignments, exams, and 2 projects will be the primary materials that will be receiving points for the grade. So there will be 5 journaling assignments, each worth 10 points, given periodically throughout the summer semester or the summer session here. And the exams, there will be 2 of them, multiple choice, true, false, short answer, and those will be discussed kind of as they come up. And there will be 2 projects. The first one will be a group project. The second will be an individual project. So the first one, you will make a PowerPoint presentation / video demonstration / therapeutic intervention strategy written summary. So kind of the 3 parts. There will be a PowerPoint presentation, a little video, and then a written summary. And you will choose a particular intervention strategy, and I will kind of put up a sign-up sheet there. You can write down whatever your name by whatever intervention strategies that you are interested in, and I will kind of break you up into groups here. So this will be a group project, so 2 per group. If we have to have a group of 3, that's fine, but in the field of speech language pathology, there's a lot of collaboration that has to happen between speech therapists and between disciplines, between OT, PT, speech and my particular circumstance. And I'll talk about that a little bit later, my own personal experiences. So you'll have a PowerPoint presentation, a little video, a written summary, and that will be the first project. The second one will be an individual project. And this will be basically presentation of a case study. So it'll be a PowerPoint video presentation, kind of like what we did here, the first one, but this will be an individual project, relatively short, no more than like 10 minutes or so. And you should provide a brief case history, discuss evaluation results, make an argument for the validity of the particular therapeutic strategy for intervention, write a plan of care, and including like short and long-term goals. And that will be the last project there. Right. So yeah, if you need help, I'm sure that you've heard this before in other courses. If you need help, do not wait till the last minute. Email early, email often. Let me know what's going on if you do need assistance or clarifications. Grading determinations, that's pretty straightforward. Classroom policies. Turn things in on time, basically. Check Blackboard regularly. There won't be any extra credit outside of what's listed. Yeah, a lot of these are pretty basic. Behave professionally, academic dishonesty statements, disability statements, tutorial assistance if it's required. Obviously, you can contact me and I can help you as well. We can set up something like a phone call or a Skype or a Zoom session, and we can figure it out. There are other online assistance that is available, technical and otherwise. And here's the course schedule. So it will be, this is tentative, but this is basically what it looks like. We're going to start with just kind of a medical SLP overview, educational perspectives, brain imaging, differential diagnosis of language disturbance. The first week we'll talk, and then we'll talk about assessment and management of aphasia and dementia, go into TBI in adults, then some TBI in children and adolescents, assessment and management of neurogenic speech disorders. Then we'll have an exam, and there'll also be a presentation due around the same time. Then we'll go into dysphagia assessment and management, some flexible endoscopy stuff, assessment and treatment of voice disorders, which is my particular area of expertise, rehab of head and neck cancer, resonance and velopharyngeal, a little bit of inpatient acute care, intensive care, adult neuro, medical and surgical management, and otolaryngology, caring for older adults. Let's see, end of life issues, ethics, and evidence-based interventions. And then we'll have a second presentation and final exam. So that's the syllabus. And of course, if you have any questions about that, you can email me and we can figure it out. Okay, so going right into the first section here. Okay, medical speech language pathology overview and educational perspectives. Okay, first of all, in terms of the ASHA scope of practice, we as speech language pathologists deal with disorders of voice, speech, resonance, fluency, language, cognition, and swallowing. I'm sure you're familiar with most of those. I know that some of you are first years and some of you are second years. At the end of this slideshow, there will be a prompt for a discussion board where you can discuss a little bit of your background, including what year you are, if you have any particular interests in terms of the populations that you're interested in working with, adults, children, particular disorders, and you can kind of discuss your clinical experiences, just so I have kind of a frame of reference for where everyone's coming from. Yeah, so we deal with all of these. Not everyone is interested in everything, and not everyone will actually focus on everything in terms of their clinical practice. I mean, there's more generalists and there's also more specialists. So it'd be interesting just to know what kind of interests you have. There is a ASHA practice portal. It's a great resource for getting information on evidence-based practice, practice guidelines, advice, discussion forums, etc. And this is really a very quite useful site. Let's see here. Right, so it has information on a number of disorders here. And say if you were to click on one, for example, let's say you're interested in adult TBI. It gives some basic background. It just talks about severity, incidence and prevalence, signs and symptoms, causes, roles and responsibilities, assessment, treatment. all kinds of resources and references. Really, this is a terrific reference that we have available for us in ASHA. So yeah, so check that out at your leisure. Okay, so first, medical versus non-medical speech-language pathology. There's basically two schools of thought. So medical speech-language pathology refers to a body of information and a range of clinical activities that affect a patient's health status or are affected by a patient's medical condition. So in this school of thought, medical is a specific type of speech-language pathology versus there is another kind of a school of thought that basically says that all speech-language pathology is inherently medical, because all SLP practice is based in clinical science and is therefore medical. Well, what do you think? All right, and according to Johnson and Jacobson in the textbook, an approach to it is an approach to patient care and a specific set of clinical processes and outcomes that are related to the medical, social, and psychological well-being of the patient. So you can discuss medical speech language pathology in terms of where it's practiced. Are we talking about acute care? Are we talking about a skilled nursing facility, long-term care, the intensive care unit, versus something like a school setting that would not be considered medical, right? You can talk about medical SLP in terms of who delivers speech language services and how and what types of services are performed. All right, relative to the continuum of care, once a patient has, say, an accident, say there's a cerebrovascular accident, a stroke, or maybe a traumatic brain injury, they would first, go to the hospital. And at this point, they might be seen in acute care, in an acute care hospital setting by a speech language pathologist. And the work in this type of acute setting is very diagnostic heavy, right? So in this particular setting, there will be less time, generally speaking, for therapy, as patients are typically hospitalized for a short stay. There will be rapid changes in patient status in terms of their cognitive communication, their swallowing, their medical status. The speech language pathologist in this case might have somewhat of a consultative role rather, in that they are being consulted by other health professionals like doctors, nurses, other rehab professionals potentially. Typically, they are referred by my medical doctor. There's an evaluation or series of evaluations that's done. You monitor the status for a while. There's patient and possibly caregiver education that is performed, therapy recommendations, and then without much ado, there's discharge planning. So they go from this acute care setting to some other chronic care type facility. And the chronic care stage here, this is oftentimes long-term rehab, skilled nursing facility type of a setting. And in this setting, there's more time for therapy. We might be talking about weeks, months, in some cases, even years. So you can really observe long-term changes and you can develop and fully implement a full plan of care here. And this looks like you get a referral from a physician typically, or potentially a nurse or another therapist. You'll do a chart review, kind of patient history. There will be an interview of the patient and caregiver. You'll do an evaluation or series of evaluations, develop a plan of care with short-term and long-term goals. There will be patient and caregiver education, and then there will be therapy for weeks and months. There will be reevaluation. The plan of care might change dynamically as needed. And you might repeat some of these steps here. And eventually there will be a plan for discharge, either to a long-term care facility or an assisted living facility, or independent living, or just back to home, wherever the person has a goal for it. And if they're able to meet that goal, then they get to go home, or they get to go to their assisted living facility. And in this chronic care facility, the whole point is to strengthen function, cognitive communication, swallowing. Basically, because they're more medically stable, we can really work on strengthening function versus just getting them medically stable and just kind of triage. And then there will be a lot of rehabilitation and then monitoring, a lot of monitoring as well in this setting. Okay, so palliative and hospice care. So this is kind of easing suffering at end of life. In this type of a setting, you might ask yourself, and you even might ask the family, you might talk to the family, you might talk to the patient, kind of just determine if services are appropriate, talk to the rehab team. The goal with these types of patients might not be necessarily rehabilitation to get the function, back to their prior level of function, or but just to kind of facilitate communication between patient and caregivers, facilitate nutrition, just generally providing more comfort for the patients. There will be probably a heavy counseling role between the speech language pathologist, the team, and the family and the patient relative to cognitive communication and swallowing issues. And there are some good resources that are given in the book on this. These are some pretty good ones. So you can check these out at your leisure. P's in primary care. So when one refers to primary care, you're referring to the level of a health services system that provides entry into the system for all new needs and problems, provides person-focused, not disease-oriented care over time, provides care for all but very uncommon or unusual conditions, and coordinates or integrates care regardless of where the care is delivered and who provides it. So this is basically the point of entry into the healthcare system. Let's see, and in this particular role, the SLP or setting, the SLP might act as a consultant to primary healthcare providers and communicate with these individuals to educate regarding our particular areas of specialty or scope of practice, what we can help them with, help the patients with. All right, there are a number of subspecializations in medical speech language pathology that we can discuss. So this might refer to, the specialization might refer to a typical, a particular type of disorder or a particular patient type. Could be neurogenic, voice, swallowing, tracheostomy, ventilator dependent, pediatric. And it follows the medical model where there's a specialty, residency, and maybe a subspecialty via some kind of a fellowship. The structure for continuing education and specialization in speech language pathology is not nearly so developed. There are some resources, though, if you are interested in specializing or subspecializing in a particular area, namely the ASHA special interest groups. They have these emerging standards for specialty recognition. You can check this out. If you're interested in neuro, you can check out the ANCDS website here as well. And they kind of discuss some ideas about specialization. There are a number of things that one can specialize in, continuing education type options after one becomes a working speech language pathologist in a particular setting. And so when you're looking at this type of this potential option of specializing, what are the appropriate formal standards for specialization? Well, there might be it might be some type of a competency. There might be an exam. It might be in the case of ANCDS, I believe they actually require that you do a kind of a case review and then present it. It's kind of an interesting take on things. Here we go. So for board certification process, so you have to submit and review a case study, a first one. If you pass that one, you submit a second case study. There's an oral presentation and discussion, and then a final evaluation. So there's kind of a series of steps that you would have to go through if you're interested in being quote unquote board certified as a Academy of Neurogenic Communication Disorders and Sciences professional. But these are things that are available to you. All right, procedures and competencies. So diagnosis and therapy often rely on a variety of different technological resources. So things like video fluoroscopy, so modified barium swallow studies, endoscopy for like fiber optic endoscopic evaluations of swallowing or FEES, AAC, alternative augmentative communication devices. So these are all resources that we can use. And we didn't used to have these. Obviously, technology has changed over time, and we will continue to have emergent technologies that we'll rely on more and more, I'm sure, as the medical field and as the speech language pathology field develops. And this is partly due to the fact that insurance companies have high standards for clinical expertise, and they want to reduce patient risk, and they want to have us, we need to have valid assessments and valid therapeutic modalities. And these types of technologies can, they can view things that we couldn't view before, for example, or they might be able to collect data that we wouldn't otherwise be able to collect. So these are good tools that we have in our toolkit here. Okay. So practice trends. Medical speech language pathology is a dynamic due to constant changes in the state of knowledge in medicine, rehab, psychology, as well as a lot of other areas. And so we kind of always have to stay up to date. We have to always read, we have to go to conferences, learn about new diagnostic and therapeutic modalities. We have to constantly refresh our page or constantly download the software so that we're up to date. All right, there is an option for a consultative, consultative practice rather, for a speech language pathologist, and this also oftentimes consists of kind of a private practice type setting. Now, in this, I don't have any personal experience with this. However, I know that these types of sessions are typically kind of intensive, short-term encounters, and in this particular type of practice, you prepare patients and families and other caregivers to deliver their own treatment. So there's a lot of focus on developing awareness, self-monitoring, and feedback, which is something that you do in other settings as well, but it's particularly important in this consultative practice. Generalization, which is how practice on one target affects a similar but an unrelated target. Carryover retention, which is performance levels after practice or after the course of therapy is completed. And then there's there might be booster sessions that might happen in the future. And as always, the goal is safe, quality, economical care. Okay, technological developments in clinical practice. So of course, you will, as I did, deal with electronic medical records. These are good for the most part. I mean, obviously technological issues always can occur, but it's good to have consolidation of information. It's easier to communicate across facilities, to share information across facilities. And you can use large data sets to answer clinical questions, which is great to have this kind of access to kind of so-called big data to kind of answer clinical questions. Other technological resources might be things like clinical applications or apps. So things like biofeedback, for example, DB monitoring for LSVT-based therapy in patients with Parkinson's disease might be one. Then there's telepractice or telehealth. So kind of therapy via Zoom, so to speak. And this can be utilized to provide services for individuals who live very far away from a provider, or that maybe they have limited mobility or transportation issues. It can be utilized during a health lockdown, such as COVID, and this will be increasingly important as a method of service delivery in the future. Okay, ethical issues. So ethical practice refers to the application of standards of service delivery. So basically, you want to avoid misrepresenting services, performing only activities for which you're qualified, adhering to the preferred practice patterns, kind of providing optimal service. And of course, you provide service in the best interest of the patient, right? ASHA has a page on scope of practice, which is good to review here. All right, so scope of practice. It provides, let's see, where we go, statement of purpose, definitions of a speech language pathologist, framework. All right, service delivery domains, collaboration, counseling, wellness, and prevention, screening, assessment, treatment. Textual factors, collaboration. So it kind of goes through each of those aspects there. Here we go. So speech language pathology service delivery areas. So we are able to provide, speech language pathologists are able to provide support in the areas of fluency, speech production, language, cognition, voice, resonance, feeding and swallowing, auditory habilitation or rehabilitation, and a number of, well, potential etiologies of communication and swallowing disorders. So these are just some examples of some of those disorders. Some elective services that we can also provide assistance with. Right, so that's a good resource for you as well. If you have any questions about scope of practice, that would be a good website to check out. And dysphagia is an interesting kind of example here. There's an application of ethical principles to the patient and family regarding decisions for the type of feeding, withdrawal of feeding, oral feeding, the presence of aspiration risk. So kind of quality versus quantity of life questions, especially if the patient is at a high risk of is at a high risk of aspirating, and the family wants them to have a particular diet, the patient wants themselves to have a particular diet, but it's not necessarily the most safe for them. Should they be allowed, especially if it's kind of towards the end of life, palliative care, for them to have, the food that they would like to have before they pass away, for example? So quality versus quantity of life. And these are very important ethical questions to discuss. Okay, interprofessional issues. So this refers to interacting with other disciplines. So you will, as a speech language pathologist, interact with physicians. You'll interact with, just general primary care physicians, but also specialists, generalists, otolaryngologists, gastroenterologists. Potentially, well, depending on the setting, you will likely interact with rehab professionals, OTPT. I work in a skilled nursing facility, in about 5 skilled nursing facilities, just PRN in the Northwest Ohio area. And I'm constantly interacting with OT and PT for the care of the patient, as well as nurses. Nurses are, they're on the front line. They're very, very important resources. You may also work with audiologists, with psychologists, other healthcare professionals. And there can be some issues that occur, conflicts over turf or competence or perceived power. But and these can be exacerbated if there are limited resources available to the facility or to the team. And really, in order to minimize this, the orientation should always be, how can I help the patient? What can I do in order to help them? And it might be, stepping down and let someone else taking kind of a leadership role. That's okay. Or sometimes it might be leading yourself and saying, I think that they really need this because they were having a problem with this area and they really need this kind of support. If you operate from a perspective of how can I help the patient, then these types of kind of petty squabbles are they don't happen nearly so much. Healthcare professions it's a stressful place, but you can minimize this just by focusing on the patient. All right, so issues in service delivery. Health insurance, unfortunately, is changing how we practice. There are increased attention that is being given to costs, resources. They want to reduce the length and variety of patient services. There's an emphasis of prevention over treatment, and they need a lot of performance measurement. We do, I did one today. In fact, we did a recertification for a few different patients, and you have to track kind of progress over time, make an argument for why the patient still needs therapy, or in the initial stages in diagnosis and in the eval kind of stage, the diagnostic, you need to make an argument for why the patient needs services initially, right? So this should always be something in the back of your mind. How can you make an argument that the patient could benefit from services? We have to be able to continuously demonstrate a rationale for our services and the costs incurred on behalf of the patient. This is very important nowadays. Okay, so a summary of professional issues here. You want to maintain updated education. Consider continuing education a professional mandate for survival. read, attend conferences, get ASHA CEUs, consider specialty recognition, know and maintain high standards of practice, provide safe, efficient, timely care, review these resources regularly. So ASHA, ASHA SIGs, and Standards Council. If you're interested in specialization, ANCDS, CARF is another one. Establish familiarity with other professionals and practitioners so that you can make referrals when needed. So primary care physicians, specialists, nurses, dietitians, pharmacists, rehab personnel. It's good to just get to know folks, all right? Consider the roles and responsibilities beyond existing models. So beyond just rehab, preventative care, consultation, collaboration, we are going to have to evolve as the field evolves, right? Professional involvement for networking is very important, exchanging ideas and information, exchanging resources and data, finding new resources and data. So things like conferences, again, ASHA, state speech language pathology organizations, consumer support organizations, all kinds of organizations. Okay, so that is the first section here. Let's move on to educational perspectives. So the second section is on educational perspectives. Education in the pre-professional or grad student stages are highly standardized. There are very particular learning objectives that are given from ASHA that one has to meet as a grad student, right? In post-grad, in professional life, there's not a standardized education anymore after the master's degree. So advancing competence, finding a specialization, kind of carving out a leadership role is not well developed, unfortunately. Clinical approaches that we are typically utilizing, they focus on behavioral counseling and educational techniques. But there's kind of a move to more physiologically based assessments and treatments, things like endoscopy and imaging. And there's kind of a balance of, in the educational setting, of clinical or medical and school setting training. So kind of a generalist approach. So you're learning how to operate as a medical SLP, while at the same time learning how to operate as a school SLP, which is nice in that it allows you a certain amount of flexibility to change settings if you so desire, but that also requires quite a broad educational practicum. So if one wanted to, for example, only focus on the medical aspects, at this time you couldn't do so because there is a generalist approach to education. Okay, so there are ASHA certification standards. Again, I'll direct you to this website here, this ASHA website, which has a little bit of information about certification standards. Here we are. This is 2020 standards and implementation procedures for the clinical certificate of clinical competency in speech language pathology. Right, and so there are very particular standards that are given, and you can review these at your leisure. Yep. Okay, so these provide guidance on pre-professional meaning prerequisite knowledge before grad school, then grad school coursework, and throughout the practicum, and then national certification exam. So pre-professional is kind of all of these parts here. And then there's professional or post-grad, which is your CFY, and then certification maintenance and CEUs as you function as a working SLP. And these standards encourage career-long learning. It is a necessity, as I said before, to maintain a working knowledge of new diagnostic and therapeutic modalities throughout your career. So there is this kind of 4-factor developmental model of education for speech-language pathology, where here we have speech-language pathology lifelong education, and there are all these components that kind of go into it. So the curriculum for the pre-professional, like what's the sequence that should be taught, what's the most effective and efficient way to learn the material, how are these skills and knowledge components, and how is competency assessed and reported, And then there was this idea of continuous improvement. How can errors in the system be addressed or changed? Okay, and then there's a general educational model. So here you have the undergraduate and prereq education. Then you might have, your language and speech science coursework. So this is undisordered. Then you go to disordered language and speech. And then you learn about clinical sciences, a little bit about how the clinic functions, and then some professional practice education through maybe a little bit of clinical experience. And then you have a little bit of practice across multiple settings. So you learn how this setting or that setting operates. I don't really agree with this. Evidence-based practice should actually be happening throughout this whole thing here, where you're kind of referencing research throughout the whole stage here, but it has evidence-based practice here. And then clinical fellowship experience. Obviously, you're going to have your CFY at some point, and then you have continuing professional development, like continuing education units, CEUs that you have to have every several years. You have to have a certain number of them in order to maintain national certification. Okay, so educational goals for medical SLP prep and practice. So develop comprehensive understanding of basic subject matter, establish a clear connection between learned content and real-world clinical situations, develop empathy and insight about the impact of communication impairment on an individual patient and the family. This is a big one. Developing empathy for patients is massive. You will spend a good amount of time just doing counseling. Like I know that's been the case in my personal experience. Right. There has to be a relatively comprehensive content exposure across all areas of communication disorders. We have to ensure that students are learning and they can actually apply the content. There have to be CF experiences that provide emergence of skills to practice independently, establish procedures to document and ensure that learners are safely practicing and making good decisions in high-risk situations, especially in like acute care scenarios. That's a special, much more high risk, for example, than the long-term care setting on average, I would say, just due to the medical complexity and the fragility of the patient. And ensure that a continuing education experience has been provided that's beneficial for the learner and actually enhances their practice, right? So all good things to think about. There has been a push for a clinical doctorate for a while now. Pharmacy, audiology, PTOT, they all have clinical doctorates. And there are some locations that have clinical doctorates as well in speech language pathology. Here are some guidelines that ASHA provides regarding the clinical doctorate. And there's an ASHA SIG 10, which is the higher ed special interest group. That has a little bit of information about that as well. There are a few programs that offer clinical doctorates, one of which I know is Pittsburgh, and there is an article that I saw that was published in the ASHA Wire a few years back about Pittsburgh's clinical doctorate, which you can check out. But that is always an option. If you are interested in pursuing a doctorate, but you are not so much interested in research, you're more interested in clinical practice and really digging into clinical research, that there are a few programs in the country that do offer that. They're few and far between, and they're pretty competitive. Okay, medical speech language pathology versus general curriculum, right? Just another kind of resource from your book here. A typical entry-level clinician has had exposure to medical speech language pathology that needs to be deepened. You need deeper and wider breadth of knowledge through kind of continuing education experiences, exposure to different patient populations, just practicing, evaluating, and assessing and thinking clinically. So there's kind of a differentiation between general prep and medical speech language pathology prep. Advancing within the profession. So how does the novice clinician move towards independence and expertise? Well, you can do it via post-grad study via the CFY, continuing education, specialty certification, kind of as I've discussed before there. There's integration and application of theoretical knowledge from academic training during the CF, evaluation of strengths and identification of limitations. You develop and refine clinical skills consistent with the scope of practice. And there's this advancement from kind of a constant supervision to less frequent supervision to independent practice. There is via Veterans Administration's medical centers, there are particular uh, specific to medical SLP. There are medical speech language pathology CFYs that are available. So you can look those up if you're interested specifically in a medical SLP CFY. Okay, instructional design here. There are a number of active learning methodologies that are we're not able to use right now since this is a asynchronous online course. So this involves, we can't do it in real time. We can do it kind of after the fact via a number of different types of assignments, but I can't, for example, have a classroom discussion right now because I'm recording a video. That being said, there are a number of active learning kind of paradigms that are pretty effective in terms of teaching students material. So they're not just being passively receptive, you're actually being active. So these include problem-based learning, where students are given a basic problem and kind of guided towards resources or experiences that help them solve it. There's team-based learning, which kind of uses competency and interprofessional effectiveness, group accountability, team skills to address assignments, team cooperation kind of approach. Then there's application guidelines, principles, methods. This is kind of the idea. It's not meaningful. Knowledge is not meaningful without real world experience, right? So having real world case examples to compare to kind of use to synthesize and understand knowledge is very important. So having that real world experience. Experiential or case-based methods are also very important. So allowing for practice of the decision-making on real or simulated patients. And we will have a few of these throughout the course. And when we're talking about something like, for example, giving an evaluation, kind of a standardized assessment, these are procedural skills that require practice. You need to be observed by some type of a mentor that provides feedback or evaluation. Then there's a revised performance, taking this feedback into account. And then there's repetition, given this accurate kind of corrected performance. So there's kind of a correction mechanism built in. So you have plenty of practice, you get feedback, you change according to the feedback, and you try it again, right? And the goal is to become increasingly more proficient, more independent, and be able to deal with increasingly more complex cases. Right. So relative to the university clinical experience, typically you get more straightforward cases, possibly, not always, but possibly. Typically, there's a bias towards children versus adults. More kids are in the university clinic oftentimes. Some more speech and language disorders versus like adult neuro. There's pretty close monitoring of student performance because you're beginning clinicians, and you deal with lower risk, more medically stable populations versus medically fragile folks that you might see in acute care. Once you get into medical speech language pathology in your externships and in your CFY, you'll deal with more medically complex cases of different populations, potentially, not always, but potentially. You might deal with more adults. And the monitoring will be kind of modulated depending on your experience and your competency. And then the spectrum of risk levels, it kind of depends on the setting. Like I mentioned before, the acute care setting, intensive care unit, there's going to be more risk involved than, say, for example, the SNF. So SLP skills. There are cognitive skills that you have to have as an SLP, obviously things like reasoning, critical thinking skills, perceptual judgments, decision-making. You need to be able to make good decisions in real time, right? You have high level critical thinking skills. Be able to examine patients' behavioral responses during speaking tasks, swallowing, reading, writing, thinking tasks, and a number of technical skills. And this depends somewhat on specialization, but you might have certain instrumentation that you use, maybe physiological type technological type equipment. So things like video endoscopy for fees, video fluoroscopy for modified barium swallow studies, video stroboscopy, palatography, electromyography even for measuring muscles, electroencephalography, electroglytography, photoglytography. There's a lot of different types of technologies that one can use for physiological assessment. And there's aerodynamic measurements, like the Glottal Enterprises pneumotachographic mask system for airflow, or Pentex Medical's PASS system, acoustic measurements, so looking at pitch, intensity, duration, quality of voice, capsular, spectral, or perturbation measurements, all kinds of technical skills that one can draw on. All right, and to end this particular discussion, the first video here, we'll end with a discussion board. So I'm going to have you on Blackboard. Introduce yourself. Tell me what year you are. Give me your main interests in the field. So are you interested in peds, or are you interested in adults, particular disordered populations, or what? And briefly discuss your clinical background and experiences. Like what settings, what populations, what disorders have you worked with, and where would you like to go? Yeah, so, and thank you so much, and I will see you in the next video.